Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. So we actually come back to you with part 2 with Kelly Allen as she gets into the transition between going from nurse to medical device sales rep. I'm not going to spoil it. I'm going to let you guys have it. If you can remember where we left off, we were getting into the actual things nurses need to consider before they make their transition. And we're going to get into some of the day-to-day. So let me not say any more. So without further ado, thank you again for listening to the Medical Sales Podcast. And I really hope you enjoy this interview. For all the nurses listening to this episode, give us, in the best light you can, what are the if a nurse is considering getting into the field, right? What do they need to consider? I'm sure nurses make a lot of assumptions about what the lifestyle is going to be like. Yeah. That you now have the reality on. So go ahead, side by side, nurse to rep, what needs to be considered, what needs to be not assumed, so on and so forth.
For sure. So there's definitely pros and cons to each, but like, for example, when I first started, I thought the schedule was going to be very easy, coming from 12-hour shifts, 3 to 4 days a week, or if I picked up extra, it was tiring. I'm not on my feet all the time for 12, 13 hours a day, 4 days a week. But when you clock out of the hospital as a nurse, you're done. When you're done in the OR as a rep or a clinical specialist, you're not done. People are still calling you. You're still getting emails, and your response is so important. Sometimes, especially when I was new, I'm like, remember when I was a nurse and I didn't have to answer to anyone when I was done. I clocked out and that was it. Right. And before I clocked in, if you talked to me, I wouldn't talk to you. Just wait till I clock in and then I'm ready. Right. But now, if I'm done the OR or done seeing my patients, I'm still calling people. I'm still returning calls. Again, emails, training, not just training other people, but as you know, with medical device, there's always new data and there's new technology. So it's keeping up with that, which these days technology in all the companies is very rapidly changing. Right. So you're not only keeping up with your own technology, you're keeping up with your competitors, and there's just so many moving parts, and it can be really difficult. So if you're a nurse and you're willing to have a complete lifestyle change, then go for it. But if you really like clocking out and being done, this really isn't for you. And I don't think you'd be happy doing it. But being here for almost 4 years, I struggled at first, but I'm so glad I made the change. I didn't leave nursing because I didn't like it. I was young. I had time. I had no kids, and I still don't have kids. So kudos to everybody that does that job with kids. But I was like, hey, let's try it. And I was able to make that lifestyle change because I was willing to. Gotcha. That's my advice.
Excellent. That is excellent. So, talking about that, about just the rest of your life, other things outside of work, one thing I wanna bring to the forefront is, what do you do to take care of yourself so that you can continue to get out there, stay connected to your customers, to the patients, and really serve your territory? What keeps you all in balance?
I eat. I pack a lunch. I make sure I have snacks in my car. I eat healthy. I make sure I'm active. So whether it's going to the gym, which is kind of difficult these days with COVID, because at least the city of Boston, they recently closed the gyms again. So hopefully they reopen. Just whether it's running outside, I bought a spin bike. Even though a medical device, you might have your schedule set and it can change in an instant. Right. It's more so now because everything's so unpredictable.
Makes sense.
So when we don't have a lot of cases and I am training someone, I try to give them the most like hands-on experience as I can. So over the years, I've collected demo equipment and I'll put on videos and we'll watch the videos and pause them. And then we'll go to the demo equipment and we'll have a spine model and I'll give them scenarios and just try to prep them as much as I can. It takes so much creativity in this field to do what we need to do, not just in training, but even reaching out to our customers. Not everything, but a lot is virtual now. It's not so easy to take your customers out to dinner. A lot of people are uncomfortable, even though you can go to the restaurants. You can't hold a big like advanced practitioner dinner where you have all the advanced practitioners in the area come to see a presentation and they get to network and meet each other and talk, and you just don't have that anymore. So it's just a lot of creativity and lifestyle change. It's so hard, but it's working because we're doing our best.
Yeah, you're still out there, you're still working. So that makes sense. That's awesome. Got it. Okay, so one thing I wanted to do also is just capture a full day for everyone that's curious, especially the nurses. Capture a full day. And I know your day changes all the time, but give us the most typical day you can have. When you're waking up and all the way to when you're ending. Tell us everything that happens in between.
Okay. So I'm just gonna pick a certain type of day because at 5 a.m. when I get out of bed, I have my bowl of oatmeal. If I want to work out in the morning, I will, but usually I'm an afternoon or evening workout type of person. I'll have my oatmeal. I'll read my emails in case something came in overnight or if something came in early, because if I have a surgery or a few surgeries, it's harder for me to be responsive. So I make sure I read all those emails before I'm out the door. I get ready. I get to the surgery for 6:30, even though it doesn't start until 7:30, because I need to speak to the patient beforehand. And before I speak to the patient, I have to sign in. And that might be on the other side of the hospital.
Wow.
I have to change my scrubs. And those might not be the same scrubs that the OR is wearing. They might be coming out of a vending machine in their paper scrubs. So there's a lot of things you have to do before you even get to the patient. And then you want to talk to the patient. And it's better to talk to them before anesthesia gets there, before the doctor gets there, so that because you don't want to be in their way. Again, you are the guest, but you really need to know where their pain is, because when you're in the surgery, you're going to test this stimulator and you're going to make sure it's in the areas of pain that they have. So you really want to know, because if you're in there and the doctor says, okay, where's their pain? And the patient's asleep, you better know where it is. So, you get in the case for 7:30. You have your equipment with you that you've packed ahead of time. And you've also brought it in I like to call it my body bag. It's a really large bag that I put all my equipment in.
All right.
So I have my equipment in the room. The case happens. This could be, let's pretend it's a permanent implant case. It could be an hour. It could be 3 hours, depending.
Okay.
So then after that case, let's say there's another case right after it. So I leave the room when all the sutures are being placed. I talk to the next patient in pre-op. And I want to talk to them so that I can pre-op the other one before the next one goes into the OR. So there's a lot of time management there. And then the same thing, you pre-op them, you talk to the other one, you go into the next case, you finish that. And now you have to go meet a patient at an office at maybe like 11 or noon. So you make sure that patient is post-opt, they're all set, you've answered all their questions, and then you go to an office. And now you're just meeting patients in the office setting, adjusting their stimulator. Maybe you're seeing one, maybe you're seeing two, maybe they're at their same office, maybe one is an hour away. So then your day could end at 3, your day could end at 4, and you really haven't had time to check your email again. So, we don't do that while we drive, right? So I use my drive time a lot during the day to call people back, call patients. I do my podcasting in the morning on my way to my procedure because no one's awake at that time to call me.
Right.
And that's pretty much my day. When I get home, let's say I get home at 4 or 5, I'm inputting my case information into the computer. I'm answering emails. I'm planning with my manager who's going to go where the next few days. Sometimes that's planned ahead of time, and then the schedule changes. So you have to decide, okay, who's out of this case tomorrow first to get to this place and this place. It's a lot of moving parts and keeping up with the changes and being flexible to adapt. You might drive 2 hours away and the patient doesn't show up. And you're not going to say to the doctor, well, you made me come all the way here.
Right.
You use that as, you get to see the doctor, you get to see the staff and the office staff, and you check to see if their brochures are stocked, and you can ask them, hey, is there anyone that has called the office that needs a stimulant or adjustment, or is there anyone I can educate for you? Any candidates for a trial that you're thinking about that I can call and educate them on the process?
Got it.
So even if you get there and the patient doesn't show up, there's plenty you can do. So as you can see, there's so much that can happen during a day, but I feel like I'm still missing a bunch. And I'm not going to talk your ear off on that.
I thought you were still telling me that. I'm over here listening. What do you mean? That was great. No, you wanted to say more? Say more.
Yeah, I mean, if you have corporate training modules to do, let's say there's like a new therapy, or you have to do your yearly fire safety, there's deadlines for those, and you might come at home after like a 10-hour day and you're beat. You just drove so much, you stood in the OR all day with heavy lead aprons for the x-ray, and you're tired, but you got to get those deadlines in. And I'm making it sound really terrible, but I actually really like my job.
No, this doesn't sound terrible at all. Actually, the way you make it sound is if you kind of just get to dance through your day, provide all this value to all these patients and all your customers, and then pick and choose what needs to be worked on when you want to. That actually sounds pretty ideal. That doesn't sound terrible at all. So that's fantastic. And for you to be able to end your day around 4 or 5 and then conclude with all the administration and still have time in the night to just, enjoy your personal life, that's a blessing. That's a blessing.
Yeah. I mean, sometimes there's nights where you have a conference call.
Sure.
Maybe the conference call is at 7, maybe it's at 5. If it's starting at 5 o'clock over in California and I'm in Boston, it's a little bit later, but it doesn't happen often. And when it does, it is important, but it's doable.
Yeah. That's excellent. So then in a nutshell, Kelly, what do you love most about your job?
I really like the fact that I can see patients and I can be part of seeing them go from having no quality of life from their chronic pain to having a successful trial, moving to implant, and seeing their quality of life improve. This isn't medicine, like this isn't medicinal. This is really, really light electricity that's changing lives, and it's been around for a long time. Did you know this came out in like the first implant was like 1967, I think?
Wow, 1967. Okay.
Yeah, and like the technology now, my company has an iPod as a controller. Wow. The patient can use their phone if they want to have their controller with them. It's wireless. Like what? Like technology is crazy.
It is crazy. It's a wonderful thing. That's excellent. Thank you so much, Kelly. Kelly, is there anything else you'd like to share with the audience before we wrap up for today?
I think I put everything out there, you have a great podcast. So if there's any more questions, just keep listening.
Definitely. Thank you so much for spending time with us today, Kelly.
Absolutely. Thank you so much.
All right. Goodbye. Wasn't that a great episode? See, what I loved about that episode is Kelly took us behind the curtains and we got to see exactly what goes on in the mind of a nurse when she's transitioned into the role of a medical device sales rep. And there are a couple of things to consider, right? Scheduling, for one. We have to consider the scheduling. She pointed out that nurses, when they check out, they check out. It's done. They get to go home, kick their feet up, relax with whoever, family, dinner, a TV, movie. Work is done until work starts a different day. But in the device world, the work isn't done because your customer is much more than just one patient. Your customers, the staff, the providers, and the patients. And you have to meet them at all levels to make sure that they have everything they need and they can all work together. And you're the brand of the devices being used to make that marriage go smoothly. It requires a lot from you. And this is a completely different set of pace than someone that's a nurse. And that's something that needs to be considered if you're thinking about making that transition. Sure, no more 12-hour days, but your days might look like your weeks might look like one long day because the work is never ending. The good thing about it, though, is you do get a little bit more autonomy in when you decide to do the work, but you're still taking a lot of things home. Another thing she talked about that's really important that a nurse can bring into a medical device sales role is the bedside manner. And that's a beautiful skill to have, right? Because you understand how to talk to the patient. So when you're in a case and you need to talk to the patient for any reason, like they do in neuromodulation, you're going to be able to communicate to that patient and help things run smoothly. Whereas a rep that doesn't have that kind of background, they're probably going to struggle. And also the day-to-day. Think about that day. Really go back to it. Rewind it if you need to. Can you imagine that kind of day for yourself? When you play it in your head, does it make you happy? Does it make you sad? Do you feel stress? Do you feel light? These are the kinds of things you need to ask yourself. Because just being able to have this interview to shine a light into what you could potentially encounter can really put you in a good position if this is what you want to do. And it can keep you in a good position if you realize this is what you do not want to do. But what I want to invite you to even further, for all of you nurses listening, is I want to invite you to come and learn what we do here at Evolve Your Success with the Medical Sales Career Builder. If you're thinking about getting into a program, you're thinking about going or joining an organization, you're thinking about saying, you know what, I want to leave bedside. I don't want to be a nurse anymore. I want to take the leap. Then you need to come and visit us at evolveyoursuccess.com and select Attain a Medical Sales Role, where you can get into a link that's going to take you to an actual client group session where you see exactly how we help you get those roles. If you're someone that's been on the fence and you've been trying to make this happen, you've put the word out there, people know you're interested, but for whatever reason you're not making it through the interview process, or you're not even getting the interviews, things aren't happening. Again, you need to go to evolveyoursuccess.com, select Attain Medical Sales Role, and get on a time block with us where you can see exactly what we do and how we help professionals like yourself get positions. If you want to reach out to me directly, you can just go to LinkedIn and look for Samuel Gbadebo. And if you want to reach out to the lovely Kelly Allen, she is available on LinkedIn as well, and you can just look her up, Kelly Allen, clinical specialist, and she'll come right up and you can ask her questions as well. As always, I am so proud and happy to bring you these guests and to have these great conversations about how you can get closer to your dreams and make things happen in the year of 2021. Make sure you stay tuned for another episode next week with another wonderful guest. Thank you for listening to the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.